Because the state government says it's not backing down on its drive to create effective awareness about HIV prevention and checkmating the stigmatization of persons living with the virus. The government, through the State AIDS Control Agency, has begun a series of training for religious leaders across the state for limitless knowledge transfer, even at the grassroots. Senior correspondent Jacqueline Ogo reports.
A 2018 statistic says 1.8 million people in Nigeria are living with the AIDS virus HIV, and 120,000 of them are in Lagos. That 2018 figure cannot be said to be realistic because every day people with varied behavioral patterns and sexual tendencies move from one part of the country to the other with the potential of spreading the virus. Some who already know their status don't go to care centers because they fear being identified and stigmatized.
You must use rubber.
To curb the danger inherent in the spread of the ailment, Lagos State AIDS Control Agency decided to bring the knowledge of HIV eyeball to eyeball with some religious leaders in the state to make them effective advocates against the prevention of the ailment and the stigmatization of those living with it.
Let's encourage people to know their status. And then when we sensitize the religious leaders, we remind them that there are different modes of transmission for HIV. So it's not only from sexual, encounters. What if it's from contaminated blood or using unsterilized needles or syringes?
Experts insist the stigmatization of persons living with HIV and AIDS keeps many away from testing to know their status. Some living with a health condition come down with mental illnesses because people vilify them instead of empathizing with and supporting them steadily.
Somebody could even already have mental health issues or symptoms before they get HIV. And then that complicates their matter. And then the stigma and discrimination they get as a result makes it even worse.
The participating religious leaders boast of a boost of their knowledge base and their readiness to work as change makers, especially in enlightening sexually curious young people about the importance of abstinence and safe sex.
I know I've had sometimes when somebody even told me using condom is like licking sweet with the wrapper. The issue is prevention, don't have sex, abstinence, or when you have to have, believe that you have to use condom to prevent it.
People living with HIV can live longer if they go to where they can be treated very well.
The talk is over. It's now time for action. Playing your own part to ensure that people living with HIV fulfill their potentials, it's now the target to pursue. Jacqueline Ogo, TVC News, Lagos.